Hello viewers, how are you? Hope you are fine. Welcome back to my channel Drawing Time with Story. I am here with you with a brand new video. If you are new in my channel, I will introduce myself and my channel with you. I am Suraya Parveen, and in my channel normally I select a theme or an object to draw, and while drawing you will not get bored because I will narrate you some information regarding this topic or narrate you some story regarding this topic. So at the same time you will get to enjoyment. Number one, seeing the or watching the picture or the image, and you will get some fun facts, some myth versus fact, everything you know. So please don't forget to subscribe my channel to stay connected with me, to stay connected with Drawing Time with a Story. Today I will share some information regarding COVID-19 myth versus fact, and the article I am going to share that was written by Lisa Markakis and Gabor David Callan. So let's jump to the myth versus fact time. True or false? A negative COVID test means you are safe? The answer is false. If you get a COVID-19 test and the result is negative, that means you probably were not infected at the time your sample was collected. But if you get tested too soon after exposure to the coronavirus, it could be too early for signs of infection to show up on the test. Also, testing negative for the coronavirus now doesn't mean you cannot become infected in the future or that you can immune from getting COVID-19. Another myth, true or false? Quercetin, essential oils, and other supplements can protect you from the coronavirus or treat COVID-19. The answer is false. Taking quercetin, zinc, or vitamin D and other nutritional supplements can't prevent or treat coronavirus infection or COVID-19. The same is true of essential oils. They are not effective to prevent coronavirus disease. The best ways to stay safe from COVID-19 are getting vaccinated, wearing a mask, especially in crowded or indoor settings, keeping your hands clean, and practicing physical distancing. True or false? Herd immunity will end the coronavirus pandemic, so vaccinations are not necessary. The answer is false. Herd immunity is a term that refers to cases of an infectious disease slowing down and stopping when enough people in a population have immunity, either from getting and surviving a disease or from being vaccinated. For COVID-19, letting people get the disease would result in many people getting severely sick, suffering lasting organ damage, and even dying before herd immunity could occur. Being vaccinated for COVID-19 drastically reduces your chance of having severe COVID-19. If you are exposed to SARS-CoV-2, the coronavirus that causes the disease, immunity from the vaccine may last longer than immunity from having COVID-19. Also, vaccination reduces the number of infections that give the coronavirus an opportunity to mutate. Mutants, that means variants of the virus, such as the contagious Delta variant, can delay or even prevent herd immunity from being reached. Another myth, true or false? Ivermectin cures or prevents COVID-19. The answer is false. Ivermectin is a medicine that controls parasites in animals and humans. Irresponsible and misleading reports are circulating in social media and elsewhere that Taking the drug is a safe way to prevent or cure COVID-19. The US Food and Drug Administration's FDA hasn't authorized or approved the use of ivermectin to prevent or treat COVID-19. The FDA has received reports of humans taking veterinary ivermectin. The formulas for horses and other animals are different than for people and can be very toxic, that means poisonous to humans. Taking ivermectin for non-approved reasons or in large doses can be harmful and can lead to hospitalization and even death. So please consult to your doctor if you have the symptoms of COVID-19. Another myth, true or false? Warm water or saline will protect you from getting sick if you were exposed to the COVID-19 virus. The answer is false. False reports are circulating that drinking or bathing in warm or hot water or washing out the inside of your nose with saline solution will protect you from COVID-19 if you were exposed to the coronavirus. These reports are not true. The coronavirus that causes COVID-19 is a very tiny organism and can't be rinsed or washed out of the throat or nasal passages. The best ways to prevent infection are to get vaccinated, wear a mask, and practice hand hygiene and physical distancing. So please be aware in the crowded place, maintain the physical distancing methodology as per your instruction. True or false? Children can get COVID-19. The answer is true. Children can get COVID-19. In most cases, COVID-19 seems to be milder in young children than in adults. But parents and caregivers should understand that children can be infected with the coronavirus and transmit it to others. The Centers for Disease Control and Prevention (CDC) now recommends a COVID-19 vaccine for children ages 5 and older. Johns Hopkins Medical encourages all families to have eligible children vaccinated with the COVID-19 vaccine. Currently, Pfizer's vaccine is the only approved COVID-19 vaccine for children. COVID-19 cases in children are increasing. This is partly because the available COVID-19 vaccines have only been recently authorized for children ages 5 to 11. The widespread circulation in the US of the highly contagious Delta virus of the coronavirus is another factor. In rare cases, children infected with the coronavirus can develop a serious lung infection and become very sick with COVID-19, and deaths have occurred. That's why it is important to follow proven COVID-19 precautions such as wearing a mask when in public, into places to reduce the chance of becoming infected with the coronavirus. We can help protect children who are too young to be vaccinated by ensuring that all the eligible people around them get vaccinated. True or false? You can get a face mask exemption card so you don't need to wear a mask. The answer is false. Fake cards and flyers claim that the bearers are exempt from mask wearing regulations have shown up in some areas. The cards, which some people have bought online, may have official looking logos or government insignias. They claim that people carrying them have a physical or mental condition covered by the Americans with Disabilities Act (ADA) that makes them unable to wear a face mask or covering. The US Department of Justice issued a statement about these fake mask exemptions, explaining that the cards and flyers are fraudulent. People have tried to use the fake cards to avoid wearing a mask in public places that require them, such as some stores and restaurants. The cards are not issued by the US government and are not backed by the EDA. True or false? You can protect yourself from COVID 19 by injecting, swelling, bathing in, or rubbing onto your body bleach, disinfectants, or rubbing alcohols. The answer is false. These products are highly toxic and should never be swallowed or injected into the body. Disinfectants, bleach, and soap and water may be used to clean surfaces, an important step in stopping the spread of the coronavirus that causes COVID 19. Never attempt to self treat or prevent COVID 19 by rubbing or bathing anywhere on your body with bleach, disinfectants, or rubbing alcohol. Effective hand sanitizers do contain alcohol, but they are formulated to be safe for use on hands. True or false? A vaccine to prevent COVID 19 is available. The answer is true. COVID 19 vaccines have been authorized by the US Food and Drug Administration (FDA), and one has received full FDA approval. Johns Hopkins Medicine views all FDA authorized COVID 19 vaccines as highly effective at preventing serious disease, hospitalization, and death from COVID 19. So please maintain the regulations regarding the COVID 19 and please get vaccinated if you have any chance, because it's an prevention methodization to stop the spread of the COVID 19 virus, and maintain the physical distancing as it's a method to prevent the spread of the COVID 19 virus. So, if you didn't subscribe my channel yet, please subscribe my channel. If you have any suggestions regarding my channel, regarding my video, please comment. And happy new year to you all. We hope a better 2022. Wish you good luck. See you soon with a new video. Till then, stay with me. Stay with Drawing Time with Story. Bye.